Good morning, everyone. After 1 year of planning, it's such a thrill to see such a large, beautiful audience, so I want to thank you all for joining us today. I would also like to extend my gratitude to the AAMC for sponsoring this event and making it possible to broadcast around the world for those who couldn't join us today. It is my pleasure to welcome you all to UC Davis for the 12th Annual Pre-Health and Pre-Med Professions National Conference. My name is Lillian Galley, and I'm a UC Davis alumnus, as well as this year's Chief of Staff for Pre-Health Programming. It is an honor and privilege to introduce this year's opening keynote speaker, Dr. Harvey Fineberg. Dr. Fineberg is one of the most respected and influential leaders in academic medicine. He has served as president of the Institute of Medicine, the health branch of the National Academy of Sciences, for 2 consecutive terms, prior to being honored with the status of President Emeritus. At the Institute of Medicine, he has chaired and served on a number of panels dealing with health policy issues ranging from AIDS to new medical technology. Before that, Dr. Fineberg spent many years at Harvard University, first as a college and medical student, and later as a faculty member, dean of the School of Public Health, and provost of the university. He has truly made a lasting impact on public health, both nationally and internationally, through his research on risk and decision-making, his advocacy for prevention, his relentless promotion of human rights, and the training of several generations of public health scholars and practitioners. Dr. Fineberg is the recipient of several honorary degrees, and in 2011 was rewarded the highest prize in public health, the Frank A. Calderon Prize, an award which recognized his outstanding work about the fields of health policy and medical decision-making. As a public health expert, Dr. Fineberg thinks deeply about new medicine, both its broad possibilities and the moral and philosophical questions that each new treatment brings. With so many of our nation's future health professionals in this room, it is such a great opportunity and inspiration to listen to his story today. So without further ado, please join me in welcoming Dr. Harvey Fineberg.
Well, thank you very much, Lily, and good morning, everyone. It's such a pleasure to be here with you, but the truth to be told, if I had my way, I'd be sitting where you are sitting instead of up here. Why? Because you are on the threshold of the most exciting time to enter the field of health that has ever been true in my entire professional career. And I want to share with you a couple of the big ideas and big trends that are affecting health that I think are going to be very important to you in your careers, regardless of what aspect of medicine or nursing or health you ultimately choose to pursue. But let me ask a question to start. How many of you here expect to be entering the field of nursing? How many expect to be entering the field of medicine? How many expect to be entering veterinary medicine? A few enthusiasts, to be sure. And how many expect to be in the allied health professions? How many expect to be in public health? Okay, we've got the spectrum covered. Interestingly, if you look around this auditorium, you'll see a poster. It says, "One World, One UC Davis." And that introduces actually the first big idea that I think is going to characterize the practice of the health professions in the future, and that is sometimes referred to as One Health. The basic idea of One Health is that human health, animal health, ecological well-being are all intimately tied in together. Have you heard about the Ebola crisis? Did you hear about the patient who just died in the United States and the many, many thousands who have encountered this disease in Africa? Where did Ebola come from? Where did the virus originate? How did humans contract this virus? Well, Ebola is an example of what's called a zoonotic infection. It's the same origin of the word zoo, and it means that the infection originated from contact with other animals, most likely primates, perhaps others. Have you heard about SARS? Have you heard about pandemic influenza? Have you heard about HIV/AIDS? All of these conditions are involving infectious agents that circulate among different species. And from a biological point of view, we humans are just one part of the total ecology of the living planet. Our success depends on our ability to live successfully with all organisms. Our understanding of the threats to health in animals and the well-being of our environment is going to have a profound effect on human health over time. So when you enter one of the health professions, whether it's medicine or nursing or public health or the allied health professions or veterinary medicine, you're going to find increasingly a commitment to interdisciplinary education, the importance of learning from one another and working together for the health of your patients and for the well-being of the health of the population. One health, one of the big ideas in the future. A second really significant development is sometimes called precision medicine or individualized medicine. This has its origins in the deepening understanding of the genetic and molecular basis of disease that we experience. You know, most of our understanding and thinking about diseases rests on a basis of pathology that's really a 19th century concept. The physical appearance, and then the microscopic appearance of tissues that might be affected by disease. Increasingly, scientists and investigators and clinicians have come to understand that the molecular composition of diseases like cancer have a very important influence on the nature of that disease and on the treatment that can most effectively deal with that disease, to cure it or to control it. So a scientific foundation of understanding the molecular and genetic basis of disease, coupled with increasing ability to manage increasingly precise interventions that are tuned to the individual patient. This is going to be a very important continuing growth in the health professions looking to the future. And if we can bring these first two together so that we have multidisciplinary approaches to health and a deeper scientific foundation for health, wherever you're practicing, whatever your field of research, however you are contributing to health, we will manage to have a safer and a more effective healthcare system that really meets the needs of individual patients. And simultaneously, it will help improve the health of whole populations. This brings me to the third trend, that I want to emphasize. But I want to begin with a question. How many of you believe there is a right to health? I would say most of you. How many of you believe there's not a right to health? A few. How many of you aren't sure? Everybody's either sure or unwilling to say. In the United States, it's very interesting. Is there a right to health defined in our Constitution? Look at the Bill of Rights. What does it protect? Freedom of speech, freedom of the press, freedom of religion, the right to bear arms, the right to petition the government. There's not a single word in our Constitution about any social or economic rights. In the United States, a right to health is a question that's debatable, that's political, that's a matter of individual conscience and a matter of our collective will over time. But the trend over time is clear. Increasingly, we as a society have come to recognize greater and greater responsibility to acknowledge and protect social rights as well as political and civil rights. You know that women didn't have the right to vote until the 19th Amendment. African Americans didn't have even full citizenship until the Civil War and until the Civil Rights Acts were not given full access to their political rights. There's no guarantee of an education in the Constitution, but you just heard from President Napolitano how far the state of California has progressed in providing and ensuring the opportunity for higher education for every citizen. In the same way, our country is gradually, increasingly acknowledging a responsibility to provide basic health care and access to health care to every citizen. And you, as future health professionals, will be a key part of fulfilling that dream. So you're at a great stage of beginning, open opportunity, wonderful possibilities of making a real difference. I congratulate you for choosing a career of service, and I encourage you to follow that dream. Thank you all very much.